I would say most days I did not feel well body-wise. Like, and I'm not just saying, oh, mild aches and pains. I thought, was this aging? Like at 57? I mean, really? Um, yeah, no, it was really difficult to get up out of bed. I would be afraid, and I now see it as I was afraid like my back would snap any minute because I had had some back snapping moments. And then I go to the shower, would the back snap there? Or if I had a trip, would it snap while I'm lifting a suitcase above someone's head in an airplane? Or will it snap as I'm traveling along the streets of New York? It just goes on and on. And a lot of this wasn't conscious as it was unconscious. In fact, my back is kind of spasming just thinking about it. That's a key, by the way. And if I had to, and at this time I also had days where my stomach would be in knots and not feeling good, but my back was fine. And then if my back was fine, my stomach could be off. So as I am reading, I'm listening to Dr. John Sarno, his book, The Divided Mind, oh gee, and The New Prescription. They're really good, really, really good. And I noticed I felt better just listening to them, just listening to them. And then I was watching anything I could online. There was YouTube videos by Dr. Howard Schubiner. There was Dr. David Schechter. There was Dr. Sarno, and I watched the documentary All the Rage. I also then came across a Dr. David Hanscom, who is in our area, but he's now since retired, and listened to his book, Back in Control, and that was like mind-blowing. It was just incredible. I was shocked. I was just shocked. As I listened to this, I felt better. I just felt better. The pieces just started to come together. I did get this book, Unlearn Your Pain. And Unlearn Your Pain even opened it up more, Dr. Howard Schubiner. And there's a list of all the things one can have. Tension headaches, migraine headaches. Well, as an adult, it's like, oh, I'm not even prone to headaches. In fact, I'm kind of baby around them. Like, how do people live with chronic headaches? I totally forgot that as a fifth grader, I went through a very difficult time. Abusive childhood, alcoholism, and school was my safety place because you follow the rules and the teachers were nice to you. But this particular time, I was being teased at school, and so there was really no place to go. And I got migraine headaches for almost a year. Could barely go to school a lot of times. My mom was concerned. They thought maybe this is thyroid. Then I realized I also had a duodenal ulcer as a high schooler who had the barium swallow, all that stuff. Again, more childhood traumas and an inability to express the anger I felt. And did get what I figured miraculously healed because nothing was working. I turned my life over to God and things changed significantly. But it's interesting. Back pain, yep. Neck pain, yep. I forgot that in my childhood I had bouts in middle school where my neck would just freeze up and I couldn't move it. Yep, and my dad, being who he was, would just say, oh, you're fine, and would just come and yank on it, and it's like that was not the right thing to do. Fibromyalgia, now I never wanted to think I would even begin to have this because I kind of felt that it's so nebulous, and if I owned some nebulous disease, would it make it worse? But I can relate. The TMJ, chronic abdominal and pelvic pain, yep. Piriformis syndrome, well, I've never been diagnosed diagnosed with that, but I think it's the muscles outside the buttocks, and yeah, that's what was bothering me. Sciatic pain, yep. Foot pain, yep. Irritable bowel syndrome, yep. Interstitial cystitis or irritable bladder syndrome, yep. Insomnia. As a child, now I can go to sleep pretty easily, but as a child I had really not good insomnia. Chronic fatigue, yep. Paresthesias, numbingness, tingling, burning, yep. Tinnitus, oh, I forgot the tinnitus. I had ringing in the ears after having a tooth pulled, a wisdom tooth, and I then obsessed on that. I kind of knew through my neurofeedback training that there was an element of OCD to that, so I kind of ignore it. But towards the end, I got it a lot, and in fact, it really helped me see that the back pain, if I'm having back pain at the same time of tinnitus when waking up with, muscle tension so bad, that this was emotional. This was not a structural thing. By the way, with the tinnitus, it was serious enough. I went to an ear doctor, and so I was also getting hearing sensitivity. Like I felt like my wife, bless her heart, but was just making lots of noise, slamming cupboards, clanging dishes. It turns out that it was, I think it's called hyperacusis, like this extra, it was kind of a nerves thing. Dizziness. I was getting dizziness. Like, oh no. I mean, it wasn't a lot, but I would lose my balance a bit. And then anxiety, depression, and OCD, yeah, mild. Although, at times in my life, it was a little bit worse where I had obsessive thoughts thinking a sharp object might go into my eye. And then post-traumatic stress disorder and multiple chemical sensitivities. I have food. Yeah. So there is enough here to then help me realize this can't all be structural. And in another video, we'll talk about the science behind this. But since doing the work, the emotional work around all this, it's like a life changer. Like a life changer. I don't have half the pain or even 3/4 of the pain I had. If a little tinnitus comes or a little spasm here, I don't go into OCD and spin cycle. I don't feel frightened at an unconscious level. I'm not going to stop my life. And thankfully, I didn't really stop my life too much. It was just that I was just not feeling well while going through it. Now I feel a lot better. Oh, I was going to say that I would have 2 good days in a month. And they were such a novel thing. I wondered what happened, like what made the difference? And I would try to figure that out. And that's also not necessarily helpful because with anxiety we get very pinpointed spotlight focus trying to figure out how can I make this go away. Now I'd say it's the opposite, that most days I feel fine and other days I have back spasms and I know that something's bothering me. The short story on what I do is I believe in working through emotional issues. When I scan my body and I'm not feeling well, I ask myself, how is this psychological? What's going on emotionally? I just don't run down the path of what did I eat? What did I lift? What chair did I sit in? When I learned, Dr. Sarno said sitting in a chair is not going to injure you. Then I realized, my gosh, sleeping. I was afraid to sleep, that I would twist and turn in the wrong way and wake up with something. Yeah, no, sleeping is not usually injurious to someone's health. Neither is walking. Neither is exercise. Now, of course, you can injure yourself in a short-term way, but when I learned that if something's lasting for months, that's something else. So not only do I get freedom from physical pain, but my overall awareness of a human being is gotten much better. I think I'm more effective in terms of helping clients because I'm now more effective in understanding what I'm going through and how to set limits and how to take care of myself in a better way.